Hello and welcome. Today we're doing an educational tutorial on how to do lip augmentation with lip fillers. One of many fillers that you can use, which we'll be using today, is Juvederm Ultra XC. You can also use Restylane or you can use Belotero. So there are many options on the market. They're all pure hyaluronic acid fillers. So the first thing we're going to do is we actually put our 30 gauge needle for the lips on. We're going to prime the needle and we flick off the tip, not touching our needle, for you never want to be able to touch the needle tip because that goes into the patient's lips or face or mouth or skin. We've already prepped our patient, we've already done our full consultation, and just to take a look at the consultation, we have to take a look and see which side we are going to start on first. We always start with the area that's the most asymmetric, and as we can see here on the lips on our model, her right upper border in the vermilion is lower and more slanted than the left. Her left is actually more elongated. So this is the side that we're going to work on first, given the fact that we want to augment and fix that area. So the first thing we're going to take a look at is, do we need to fill the border, which is the vermilion border, or the body? When you're injecting the vermilion border, you actually go into the vermilion border, not outside of it, or else you can go into the wet dry border, which is on the inside of the lip, which is to build the body. So here we're going to demonstrate how we actually measure from the entry point to where actually it's going to stop, which is the body. This is the wet to dry border that we will be entering, and we're going to go ahead and enter in here. Patient is nice and comfortable, she doesn't feel anything, and we go ahead and inject in a retrograde linear fashion to build the volume as we pull out and we stop. Then we go ahead and just mold the lip area, and that was just a little bit. The product goes a very long way with just a few 0.1, 0.05. There's no exact direct measurement. It's all visual. Close your lips, please. Okay. And as you can see, we've already elongated the length of the lip to match the other side of the lip. Since just a little bit of that helped with there, and then we just need to finish because we measured from here to here, we stopped. So now we go from the other entry point once again, and we go to just in front of the cupid without distorting the cupid's bow or the philtrum. You never ever want to distort the philtrum or the cupid's bow. Many people sometimes come in actually wanting the cupid's bow and philtrum to be more defined. So as we can see here already, the transformation. And we're going to go ahead and now go into the vermilion border to help pick up the border for her. Once again, it's in a retrograde linear fashion. We're just doing one thread of the filler. So as we can see here, we already did one side of the lip, and this side of the lip, as we can see with the augmentation, we already rolled out the lower lip. So we did 1/3 of the lower lip because the lower lip is divided into 1/3 outer, 1/3 middle, 1/3 outer. So these are the lateral areas of the lower lip, whereas the upper lip only has a outer, top, and bottom that you can do in one injection with a retrograde linear threading. We already went ahead and built her lips. She's already developing some swelling there. I also went ahead and added PDO threads because PDO threads can be used along with hyaluronic acid fillers for lip augmentation and to help roll the vermilion border up without over volumizing the lip with any filler product, especially for patients who actually do want to have a nice natural lip without too much volume. So now we're going to go to the other side here in order to make it equal. This side was more deficient, so this side is not going to need as much. So I'm going to have her just slightly part her lip, and we're going to go into the body, which is the wet dry border. Patient has some numbing, and we did a dental block earlier, and we went ahead here and just filled up the lip. Closed. Okay, open. And as I said, we can do in halves. So we're going to go here and back into this injection point. And it's a retrograde linear thread. We just go ahead and mold the filler product. And these are all pure hyaluronic acid fillers, as we said earlier. So you can always dissolve them if you need to, or if the patient doesn't want as much volume. And now we're going to go to the vermilion border to give it a little more definition, and that's the upper portion of the lip right into the vermilion border. And once again, we're just doing little bit of linear retrograde threading, not even 0.1 of the product. So the entire syringe, which is 1 cc, goes quite a long way. Can everyone see here now how her upper lip is much more volumized and even? Now we're going to go out to the lateral 1/3. We're going to go right into the vermilion border to accentuate the lower part of the lip. Close your lip. Now go ahead and pucker for me. And she's numb. And as we take a look, the reason I have my patients pucker when we're doing this is because we want to take a look when they pucker. Granted, she has a dental block, so it's distorting a little bit of hers, but it allow me to have a better visual, so I could see. As you can see, the curvatures are even, her lower is even. Relax. So now all I need to do is to actually go into the middle 1/3 of the lower lip to give her a little bit of a pout, which is what she wants. Everybody wants that lower lip sexy pout. And we opened up her oral commissure by doing also a thread with the PDO threads along with the hyaluronic acid filler in order to straighten out her commissure instead of it rolling down or being too upwards. We're going to go ahead and do that here as well. We're going to go ahead and go right across and through to just give some structural support. It's like a little strut. Just a drop goes a long way to help support the structural sides of the oral commissures without allowing the commissures to collapse inwards. And as everyone can see, take a look at her lower lip. So that's our tutorial today for doing lip augmentations with pure hyaluronic acid fillers.